Hey everyone, and welcome. Get ready, because today we are kicking off part 1 of our massive 15-part masterclass explainer on decoding interventional radiology. We're going straight into the vessels to really master the strict rules, the clinical nuances, and of course, the coding guidelines of this incredible specialty. If you've ever felt completely overwhelmed by the complexities of IR and how it differs from traditional surgery, well, you are in the exact right place to build a rock-solid foundation. Let's get to it.
Now, the core material for this deep dive actually stems from the fantastic educational foundation laid out by the AAPC local chapters. We're taking all that deep, clinical knowledge and transforming it into a highly focused explainer just for you. Together, we're going to totally conquer the complex world of vessels and catheterizations, making absolutely sure you've got the exact analytical framework you need to tackle those tricky operative reports with total confidence.
Okay, here's our roadmap for today's foundational class. First up, what is interventional radiology? Second, same-day surgery versus IR. Third, we'll look at the IVR golden rule. And finally, a quick concept check to wrap things up.
Section 1. What is interventional radiology? Defining the specialty.
So, modern healthcare utilizes some seriously advanced tech to perform incredibly precise procedures, things that used to require massive open operations. To understand how to code these correctly and, avoid those frustrating claim denials, we really have to grasp minimally invasive surgery, or MIS. This is a surgical approach that uses advanced tools to perform procedures through very small incisions, rather than your traditional large cuts. Because physicians are using these tiny portals to access internal organs, the CPT codes we select are going to look very different from open surgical codes.
Now, what makes interventional radiology so unique within this minimally invasive space? Well, it relies entirely on real-time imaging modalities. We're talking X-ray fluoroscopy, ultrasound, computed tomography or CT, and magnetic resonance imaging, MRI. In IR, these aren't just for taking static, snapshot pictures. They are literally the real-time eyes of the physician during the operation. For you as a coder, this is a huge deal. It means you're often going to be looking for both a surgical code and an imaging guidance code, specifically those radiological supervision and interpretation codes.
Picture this in a clinical setting. An ultrasound might be directly guiding the physician's hands in real time, or a massive MRI scanner might be providing immense internal detail. The physician is essentially driving specialized instruments, specifically thin tubes called catheters and specialized needles, through the body's hidden pathways. They can only navigate these vascular and non-vascular systems safely because they are constantly actively visualizing the surgical site. It's really like having a high-tech internal GPS.
Moving on to Section 2. Same-day surgery versus IR. Understanding the differences.
It's surprisingly easy to get these mixed up when you're reading a chart, but distinguishing them is absolutely critical for selecting the correct code sets. Traditional same-day surgery involves classic operations, typically utilizing anesthesia in a standard surgical environment, using an open, laparoscopic, or endoscopic approach. Interventional radiology, on the other hand, is strictly percutaneous. That means it's performed by puncturing right through the skin, using needles and catheters. IR doesn't use large scopes or open incisions. It is 100% reliant on that image guidance we just talked about. And because the physical trauma to the body is so minimal, it offers significantly faster recovery for the patient.
All right, Section 3, the IVR golden rule, the coding principle to remember.
Okay, I want to hit the brakes and slow the pace down for just a second here, because you absolutely must lock this foundational rule of thumb into your memory for coding success. Ready? All IVR procedures are part of surgery, but all surgical procedures are not part of IVR. Let that sink in for a moment. Interventional vascular radiology, or IVR, by its very nature of piercing the skin, injecting dyes, and altering internal tissues, is a surgical approach. Therefore, it lives under the massive umbrella of surgery in your coding manual. However, traditional surgeries, like say an open appendectomy or a laparoscopic gallbladder removal, do not involve the percutaneous, image-guided hallmarks of IVR. So, while IR is always surgery, surgery is definitely not always IR. Make sense?
Let's head into Section 4, quick concept check. Test your knowledge.
It's time to shift gears from passive listening to active application. Imagine you're right here in a live classroom with me right now. I want you to listen to this real-world clinical scenario and mentally lock in your answer as if you are boldly raising your hand. Ready for this?
Here is the clinical scenario straight from a chart. A physician performed a catheterization injection procedure for an antegrade nephrostogram and/or ureterogram.
This was a complete diagnostic procedure, including imaging guidance and all associated radiological supervision and interpretation. Based on what we've just covered, what type of procedure is it? Is it option 1, vascular IR, option 2, non-vascular IR, option 3, both, or option 4, none? Think critically about the anatomy involved here. A nephrostogram and ureterogram focus on the kidneys and ureters. Are those organs part of the blood vessel system, or do they exist outside of it? How does that anatomical fact dictate its specific IR classification? Go ahead and lock in your guess right now.
So, do you have your answer? Well, I'm actually going to leave you in a little bit of suspense. But ask yourself this: if the kidneys filter blood, does that automatically make them part of the vascular system? The exact answer, and the deeper anatomical logic behind it, lies perfectly in our next explainer. Coming up in Part 2, we will fully break down vascular versus non-vascular IR classifications. You definitely won't want to miss how we decode those structural differences so you can code them flawlessly. Thank you for watching, and keep learning with Decode Healthcare with Harshal.